I read you worked in emergency medicine, and you found that took up a lot of time, and you decided to become an entrepreneur. That's an interesting one.
Yeah, I was
Explain
an
that
ER
to me.
doctor. I was an ER doctor for about 10 years. I went through residency and then worked in busy ERs in Texas and Arizona. And it was great. It was a fun job, but it is also a very stressful job. You're working holidays and weekends and birthday parties, and you're getting up at 3 in the morning to go to work. And so after doing that for many years, and then when my kids were little, I started just realizing that I was becoming more and more unhealthy, and that I needed to make some changes if I wanted to not be going into the ER to get seen for some kind of chronic medical problem in the future.
Yeah, no, that's something that's quite audacious though. To like make that transition. Was there like
It,
one moment that you were like, I gotta do this?
Yeah, there was one day. So my kids were little at the time. They were like, I had 3 kids under the age of 2. And
Okay.
so I was sleeping just a few hours a night, like wasn't exercising, wasn't eating well, like just stressed, all the things. And I kind of wasn't doing all that well. And then I went to work one day and I was looking out at all the patients in the ER waiting room, people waiting to be seen for their mostly chronic medical problems. And I just realized that if I didn't make a change in my own life, that I was going to be one of those people in 5 years or 10 years, waiting there with my chronic medical problem that probably could have been prevented if I'd just taken the time and educated myself. So I left the ER, kind of just like cut off ties, and started my own clinic, which I had never done before. So that was a big adventure. And
Mm-hmm.
then ever since then, I've gotten the entrepreneurial bug, and it's been super fun. So 10 years since I left the ER.
Okay, cool. It's been a decade. What was it initially about healthcare in general that attracted you?
I've always loved science. I'm kind of a science nerd, and so my college major was biomedical science. I love learning about science, and I remember I was working at Yellowstone National Park for several summers during college. And I didn't really have a plan for after college, and I just kind of realized that everyone else who was in my specialty was going into medicine. I wasn't sure I wanted to or not, but I thought it was at least an interesting thing to go into, and so I just kind of fell into it. Honestly, it wasn't something that was like a burning passion, but once I got into it, I really enjoyed how, just learning about how our bodies worked, and science and medicine and working with people. And I think it's super fun to be still in that world, but also being able to see it from kind of the business side as well.
Yeah, no, for sure. What's it like starting those clinics and your companies and all that? What just opening it all up? What's that like?
Yeah, so I'm a co-founder and chief medical officer of a longevity kind of health optimization clinic franchise. And we just launched our first office in Austin, Texas, here in the US. And we have 2 more coming early next year as well in Texas and Florida. And so, the last year I've spent working on that project with my team, and building up clinical protocols and training people and bringing in new hires, and it's been super fun. I've never been in a startup like this, where we're actually raising money, and we're well funded, and we have really high level people involved. In the past, it had just been me kind of starting different projects and kind of hoping they went well, but this is the first time it's really well organized, and I'm kind of part of a bigger system. So it's really fun. It's a little frustrating sometimes, because I feel like I'm so used to kind of getting my way,
Right.
making a decision and just doing it, and now I have to make decisions, and then I have to have 10 people kind of say yes, that's a good idea, or no, it's not. So I'm having to learn a little bit about playing with others.
Yeah, no, besides that, like, what's the hardest part of it? Because that's, like I said, that's not nothing to start up something like that.
Yeah. I mean, the hardest part is we're doing many different things in medicine, and that we're trying to do them at scale. So we're trying, we're essentially working on this let's like longevity medicine, which is a very preventative, proactive, tech-enabled medicine. But we also do hormone replacement, we do peptides, we do regenerative medicine, so stem cell medicine. And so we're doing a bunch of different things, all of which are complex, all of which are different. And we're trying to scale it in a way that no one has done before, because it's very difficult to scale this kind of practice.
Yeah, no, I can imagine. Explain humanoid health. Like, what do you guys do in just the broader picture of it?
Yeah, so we are, I describe it as being longevity and health optimization, kind of a layer above just your primary care doctor. Usually your own doctor, you see, I don't know how it is there where you are, but here in the States, you see your primary care doctor for about 10 minutes once a year. maybe,
Yeah.
unless you have a medical problem that you want to go see them for. And so really they're just there, to catch you if something seriously is wrong. They're not going to be really helping you much with preventing diseases or helping you live better every day. And so at Humanaut, we're really trying to be, work with you more closely, be your co-pilot. And we're also much more willing to adopt sort of novel therapies, HRT, TRT, peptides, things like that maybe traditional doctors aren't quite ready to adopt yet.
Okay, I heard it. Longevity-wise, like what does optimal health mean from your perspective?
To me, optimal health just means feeling as good as you possibly can and always being ready to go out, for the next adventure with your friends and family. And I think that we talk a lot about like lifespan and longevity and trying to increase lifespan. Right now we don't really have the technologies to increase lifespan too much outside of just preventing chronic diseases that will kill you. But I do think that we have the ability to increase health span, which is that, amount of time spent in a really healthy state. If we could do that, we can improve your life, significantly.
Yeah, no, for sure. So what is it like someone comes into the clinic and then what? How do you help them?
So we have, when people first come in and they get membership, they do like a monthly subscription usually.
Right.
We do multiple hours of testing. We do a bunch of functional medicine testing and health testing. We know VO2 max testing and flexibility and mobility and all different stuff. We have a longevity gym where we do all of the assessments with an exercise physiologist. We do a bunch of blood tests, 80 to 100 blood markers. And then we also do some other novel tests, like we do a WAVI scan, which is an EEG of the head. We're looking at your brain activity and speed. We look at your carotid arteries with an ultrasound. We look, just multiple things. So we can really kind of evaluate health from multiple angles. And then we help and put together a very comprehensive plan. And then we stay with you, through time to make sure that that plan is working for you.
Right. Is there a thing that people that come into the clinic, there's like a common health issue they experience they weren't aware of?
We have a few different groups of people. We have relatively young, healthy people, and by young, I mean, 30s, 40s, somewhere in that
Sure.
age group, who maybe they're starting to feel a little bit of the changes associated with aging. Like they're feeling a little stiff. They don't recover quite as quickly from the gym. Maybe they're getting a little belly fat, nothing horrible, but they're like, oh, I'm not 20 anymore. So that group who's really just kind of interested in optimizing health, but they're not really in a bad space. And then we get a lot of women and men in their 45, 50 range who are seeing significant hormonal changes and a lot of health changes because of that. And then we have a smaller group of people who have maybe some chronic medical problems that they're seeing a specialist for, but they don't feel like they're getting to the root of the problem. And they really want to dive deeper and, see if there are other things outside of traditional medications that might be able to help them.
Interesting. Might be like a dumb question, but just like age-wise, I hear so many people, it's just you get older and things start to decay. Is that necessary, or is that just happens, or what's your view on that?
That's a great question.
Yeah.
I don't think it's necessary, but I do think it's very common, and that if you don't take action, then it does become your reality. So, we do have testosterone peaks at about age 25 in both men and women. And
Right.
so that's one of the hormones, of course, that is going to help keep you vibrant. It's an anabolic hormone. And so it goes down as you get older. Certainly there are things you can do with your lifestyle, especially for men, to improve testosterone. But at some point, your body does stop making some of these hormones, and maybe, you need a little additional help. But I do think that changing lifestyle, eating well, sleeping well, reducing stress, exercising, just the basics, I think that those definitely go a long way in helping to prevent the problems, but they don't necessarily always go all the way as you get a little older.
Sure. Your view on supplements, things you do besides supplements that have, for you specifically, done a lot for your longevity and the way you feel and your mood and things like that?
I do like supplements. I have a female women's focused supplement company called Hop, and we have a longevity product for women. So I like supplements for sure, but I don't think that they're the end all be all. I like obviously all the foundational stuff we just talked about. I'm a big fan of getting out in nature. I live in the mountains in Utah, so I like to go on hikes in nature, and I talk to the trees and I talk to the moose, and it's
Nice.
it's a whole thing. But so I think that's really great for the mind and the body both. I also like some of the kind of biohacker tools tools like I enjoy red light therapy, the panels or the face wraps or things like that. I do cold plunges more in the summer than the winter, but I still do those to try to wake me up a little bit. I do some different peptides for myself. I kind of alternate and try different ones depending on kind of the cycle that I'm in, and certainly hormones as well, like testosterone, progesterone, things like that.
What has the cold plunge done for you?
It's funny. I did it when I first started cold plunging was about 2 years ago, and I got the cold plunge, and it was the middle of winter, and it was, this much snow on the ground and 25 degrees out here. And I was like, I'm going to do, 30 days in a row of cold plunging, no matter what. And I just went right into it. And it was hard every single day, and I never got used to it, but I did find, I felt great afterwards. I didn't really see a lot of other changes, but then one day, shortly after that, I was in my car driving down the mountain with my kids, and they're in the back seat. I'm driving in like a Tesla, and it was horrible weather conditions. It was snowing and icing, and the roads were covered in ice, and we're going down this mountain pass, and it was just extremely treacherous. Like I'm slipping, I'm sliding, the cars are kind of going off the roads. I'm so scared. And I found myself like breathing, like doing like the deep kind of slow breathing that I do in the cold plunge. That's just very slow, calms me down. And I didn't realize that I was doing it until I'd been doing it for a while. But once I got down the mountain and I was safe, I was reflecting on that and thinking, I really do think that those cold plunges taught my nervous system how to behave in a way that was able to calm me down and keep me safe in that situation. And if I hadn't been doing it, I'm not sure I would have been as calm.
That's a great one. That's a good one. I heard Rogan talk with David Goggins about the cold plunging. And his methodology is that if you do it first thing in the morning and you work out after, it's like it would like exponentially increase your testosterone. And I've like tried researching it. I don't know if it's true. So I tried doing it. It's terrible. Like first thing in the morning.
It is terrible.
I'm on day 4 right now. It's terrible, but
it is terrible. There's not really a lot of research. I've looked into this as well. There's not really a lot of research on testosterone and cold plunges. It's much more like a theoretical thing. There's an idea that maybe if you get cold and you shunt blood flow kind of away from the testes because the blood flow is going centrally, then when you get warm afterwards, maybe you have a rush of blood flow that goes to the testes, and then maybe you get a boost in testosterone. But this is the kind of thing that would be easy to prove. Like someone just needs to do a quick study, and we could just not have to worry about theorizing if it's true or not. But right now I would say we just don't know.
Yeah, no one has taken the time for that. That's fine.
Yeah.
Other things you do that aren't maybe necessarily proven, but just you feel like are working for you?
A lot of the peptides that I kind of experiment with on myself and sometimes with patients as well, certainly aren't proven in humans. Most of them have animal studies. Even some of the most common peptides, like BPC 157, for example, that's the very common peptide for musculoskeletal healing. It also has neurologic benefits and skin benefits and a lot of different things. But we only really have animal studies. Even though it's been used by humans for many years and it seems very safe. So there are a lot of peptides like that, like, GHK copper is another favorite of mine. Even some of the growth hormone secretagogues, things that increase your growth hormone, like ipamorelin and CJC 1295. Those are all really used, but they're just not all that well studied.
Okay. What are peptides? I don't even know what it is.
So peptides are, sorry.
No, that's cool.
Peptides are just short proteins. And
Okay.
and maybe you don't even have them available there. They're in the US, they're kind of this group of drugs that have there are some like FDA approved peptides. Like for instance, insulin is actually a peptide. It's like a short protein. The GLP-1 medications like Ozempic, those are actually peptides as well. So it just means a very short, like just a few amino acids long protein. And what's unique about them is that there's hundreds of different peptides available. Most of them are not FDA approved. They haven't gone through the FDA approval process, but they're made by your own body and they do very specific things. So maybe one of them is really good for brain health and cognition, or one of them is good for improving sexual desire, and one is good for your skin. So they all do very specific things, and they seem in general to be pretty safe. And so we use them as physicians here in the US strategically to improve different parts of health. When we don't have medications that we like or supplements that we like, peptides kind of fill a niche there.
Okay, I hear you. Right. So testosterone is a topic, right? What do most people who are like trying to optimize it, up it, don't understand about it from your perspective?
I think I mean, I think that a lot of people don't understand that they really do, especially men, you really do have a lot of control over your testosterone usually in turn, as long as your testes are working properly, then, and so usually that's younger men, less than age 50 or so, then you can increase your own testosterone if you try hard enough in most cases. And by try hard, I mean, lifting heavy weights, getting some sun every day, making sure you're getting enough vitamin D and zinc and selenium and some of these micronutrients, keeping your stress down. That's really important because high stress will decrease testosterone. Sleeping, just some of the basic stuff will actually improve testosterone in men, but it can take time and it certainly can take effort. And so I think that, it's often easier to just go and get, the doctor to prescribe testosterone. But oftentimes in young men, you can increase your own production. Once you reach a certain age, your testes just really stop working as well. And then maybe you do need some help to get the levels back up again.
Mm-hmm. What's like natural to percentage wise to increase it? Like someone just average, how high can it get?
I mean, you can have a guy whose testosterone is 300, which is pretty low here in the US. And if you really work on lifestyle, if they lose weight, if they lose visceral fat, exercise, lift heavy weights over several months, you could get the testosterone to 600, 700, maybe even higher. But it is a slow process. You're not going to go from 300 to 900 in a month because your body has to, really change quite a bit to be able to increase, to send the signals to increase testosterone production to your testes.
Right. Good one. Nutrition wise, things for testosterone, I've heard not eating earlier in the day is a good one, or you should eat early in the day, stuff like that.
It's one or the other.
It's one or the other. I don't know.
I haven't seen a lot of good studies showing, aside from eating a relatively clean diet, there's some speculation that cutting out sugar or eating less sugar may help testosterone. I haven't seen studies on that, honestly, but I think that it makes sense to eat healthy, and I certainly eat enough protein. But I think that the timing, we don't really know as far as testosterone goes. I don't know at least if there's a big difference in when you eat and whether or not that helps testosterone or not.
Right. A lot of it is short term too, right? Like you don't eat, your testosterone goes up. But the same with the ice baths, like after it's down a bit, but like long term, It doesn't really do a lot.
Yeah. And testosterone fluctuates during the day. It's highest in the morning when men wake up. And then of course it goes down as the day goes on. So it makes sense. You have these variations, just like everything else, just like cortisol, just like insulin, all of the hormones are fluctuating to some degree and are affected by everything you're doing in your life.
Good one. At Humanaut, you've seen people like optimize their health and their longevity. Mistakes people make, common mistakes?
I think that the most common mistake is people just don't take notice of their health until it becomes a problem. Like they don't even think about it. And I understand that. I was the same way, but they don't really consider it or think about it or make it a priority until they start noticing problems. Like all of a sudden they're stiff in the morning, they can't wake up, they can't, they're overweight, they feel crummy, their brain is foggy, whatever. And then they start taking notice. But of course that means you've had years of low level disease or inflammation or problems that have been developing that you just didn't pay attention to. And so it's a lot harder to reverse it at that point than it would have been if we had caught it early, which is why we really advocate for, getting checked at least once a year, preferably more than that, and getting a full assessment, even if you're pretty young and healthy, because you just never know what you're going to find. And if we catch it early, then we can work with you. And oftentimes you don't need medications. You just need lifestyle changes or supplements or, some things like that to reverse that mild problem.
Mm-hmm. What do you recommend people besides just their regular checkup, like blood work, for example? What are other good ones to do on your own?
I mean, blood work, there's about 80 different blood markers that I think are important, including all the hormones, especially as you get older, especially as you hit 40 or so. Certainly all the, like an advanced lipid panel, including kind of some of the lipids that people don't necessarily check, like ApoB or Lp(a), but are very important for cardiovascular health. Certainly, all your liver, kidney, all those basic tests, but also some like inflammatory markers that people may not check all the time, like CRP or homocysteine or uric acid or ferritin. So a bunch of different lab tests. And then I also really think that VO2 max testing, the running on the treadmill until you're like super short of breath with the mask on, is an excellent test. And we know that it is very strongly correlated with health span and longevity. So people who have high VO2 maxes, they live longer, they do better. People who have low VO maxes live less long. And it's a painful test. No one likes to do it, but it tells you a lot of information.
Improving VO2, because VO2 is like, I read that too, is one of the main like markers for expected like your age. Improving it, what is it? Zone 2, zone 3, your view on it?
That's a great question. There's been a lot of talk in the last few years about zone 2. Peter Attia talks a lot about zone 2. Zone 2 meaning that your heart rate is relatively low. It's higher than baseline, but you're able to talk and carry on a sentence, and you could do that workout for several hours and you'd be okay. The theory is that if you do more zone 2, that you're going to increase mitochondrial health, and that will help VO2 max. In women, it's kind of interesting. In women, we actually don't need to do as much VO2 because at baseline, we have more mitochondria in our muscles, and we're essentially better at endurance sports at baseline than men.
Really?
And so what women need to do is we need to do a lot more zone 4 or 5. So the very high intensity intervals, like that's what's going to help us the most with improving VO2 max and just improving health in general. Men probably need a combination of zone 2 and the higher zone 4, zone 5.
Fun. Interesting. I'm just now realizing I'm studying the wrong field. I'm in law school, but I find this way more interesting. No, I had all these doctors on the past few weeks, and I'm like deeply intrigued by the whole like longevity thing and just performance optimization and everything. It's fun. I like it.
Yeah, it's super fun. It's a fun field, and there's so much to learn all the time. When I was in medical school, we had a retired attorney in our class. Mm-hmm. He'd been an attorney his whole life. He was 75 years old and decided to go into medicine. And so he was in my medical school class at age 75.
Oh, wow. That's something.
So it's not too late for you.
It's not too late. It's 21. It's not too late.
Not too late.
I love it. Talk about human optimization project. What do you guys do there?
So we call that HOP. We call it HOP for short. HOP is my women's focused longevity supplement company, and it is it's kind of a fun company. I created the product. It's called HOP Box, which is this blue box behind me. I created it. It's just a packet with 19 ingredients inside, and you take it twice a day. I created it for myself because I was not seeing what I wanted out in the world, and it was like, oh, I'm too lazy to go buy 20 bottles of different supplements and put them all together and restock them and all that. So I created it for myself, and then I started having friends and family that wanted it. And the next thing I knew, I had a product that I was marketing. We only sell in the US right now though.
Mm-hmm. Okay, cool. How are the supplements you're selling at Hub? Like, how do you know that that's what you need?
Well, we took, I did a lot of research, obviously, beforehand. I've used supplements for years in my practices, but I looked at ingredients that have good data for something specifically improving metabolic health or acting on one of the main drivers of the aging process. So for instance, we know that mitochondrial dysfunction is one of the main drivers of aging, or stem cell exhaustion, or there's like 12 different ones, inflammation. And so I chose ingredients that acted on one or more of those primary causes of aging, and then we put them together in a way where they can work synergistically, but also at safe doses. So essentially trying to find something that would be helpful for most people over the age of 30 or so, most women, but be safe, but also do something that like a multivitamin is not going to do.
Okay. Oh, yeah. Cool. Interesting. It's fun though to like create something like that. I can imagine that's a cool project to work on.
It's very fun, and the branding is super fun. The personality is very like me. It's like me in a box. Like it's kind of quirky and silly, and a lot of educational parts of it that are fun. So I've had a great time with it. I love being able to be creative, with a business because it's my business completely. I have a team, but like it's my business, so I can just I can kind of do things that are a little silly or a little wacky, and like I don't have to ask anyone. I can just do it. It's fun, so I enjoy that.
Yeah, no, I have the exact same thing with the podcast. It's just I'm still studying, right? So it's to take on like a full responsibility of like a business. That's different. But like with the podcast, just fun, like branding it, talking to all these people. It's like your thing, so that's cool. Yeah,
it's and you can you can change it if you want to. You can do whatever. Like no one, because it's just yours, and no one else's money is on the line, or reputation's on the line. Other people don't really care. You just can do what you want, which I think is a very fun way to run a business.
Yeah, no, for sure. You're involved with stem cells too, right? Explain that to me, because that's relatively new.
Yeah, so I mean, stem cells have been around for decades, but we've been talking about it a lot more, certainly in the last 5 years or so. Stem cell medicine are also called regenerative medicine, or it's a type of regenerative medicine. So stem cells are the cells in your body. They're in every tissue in your body, and they're responsible for the general upkeep of all your organs and tissues. So they have a couple of properties. They can replicate themselves and become more of themselves, or they can also differentiate and become other types of cells. So it's those two properties. And so, for instance, you have stem cells in your skin. If you cut your skin, then your stem cells will send out signals to repair the skin, and then they also may replicate themselves to have more of those signals. So with stem cell medicine, what we're doing is we're trying to take stem cells either from somewhere else in your body or from someone else, and we're putting them somewhere strategic to try to take advantage of the messaging that the stem cells do. That is a messaging all about regeneration and reducing inflammation and essentially healing tissue.
Okay, cool. So what's the full body stem cell makeover? Explain that to me then.
So that is a procedure that I do in Park City, Utah with my partner, Dr. Harry Adelson, and my business partner. He does musculoskeletal injections, which are like your knees, your hips, your shoulders, wrists, all of those things, and all on the neck and back. So he does musculoskeletal injections, and I do skin injections, scalp injections for hair restoration, and sexual injections. We essentially do all these injections over the entire body. We put you to sleep, we do your entire body, and wake you up an hour and a half later. So it's called the full body stem cell makeover.
Oh yeah, cool. Exciting outcomes you've discovered. Obviously you do it with other people, but things you've seen that like excite you stem cell wise.
I've seen a ton of people have improvement in pain, all kinds of pain, hip pain, hips that were supposed to be replaced, but instead they tried stem cells and they're able to get through several more years without having to have a hip replacement. But even just athletes who hurt themselves, aren't healing as fast as they want. We put stem cells in their Achilles tendon or their shoulder or whatever it is, and they heal a lot faster. So certainly a lot of improvements in pain. I also do a lot of cosmetic stem cells and sexual health stem cells, and it's fun to help someone just regrow their hair, and that's because that's a big when you're losing your hair, it's a big cause of stress, whether you're a male or a female. It's stressful, and if I can help you regrow your hair by just doing some injections on your scalp that take 10 minutes, it's pretty awesome.
Yeah, I hear that. Future of like the healthcare industry, things you want to see different, because I've heard you talk about that in interviews, that a lot of it is like messed up. What would you want to see different?
Oh, there's so many things. There's so many things. I think one of the biggest problems, at least here in the US, is I just did a post on this on Twitter recently, is that doctors really do want to give you good medical care. I think that some people think that doctors are shallow and they're money grubbers and they just are out for themselves. And, this perception, at least in the US, is out there. But really, none of us went into medicine to make a lot of money, because there's a lot of easier ways to make money. Like you spend 10 years of your life, 12 years of your life, accruing debt, and you don't make as much as you think you do. But the point being, we want to help people. But because of the involvement of the insurance companies here in the US, at least, the reimbursement that doctors get, especially for primary care, just like regular visits and like hormone visits like I do, the reimbursement is just awful. And so we can't actually afford to give you the care that we want to give you. We can't spend time with you that we want to spend, because we're not getting paid enough to do that. We have to move, see more patients. So I think, that's one of the problems, is how do we, and the patients are paying the insurance companies. They're spending their own money to make sure that they have insurance, and yet that money is not making it to doctors, and it's just not working for either side.
Why is that though? Like, how do you fix that?
Yeah, well, the insurance companies we have a lot of animosity towards them here currently, because a lot of the companies that, like United Healthcare, which unfortunately you probably saw that the CEO of United Healthcare, one of the big insurance companies in the US, he was killed just a few days ago, shot outside. He was shot, essentially assassinated, by someone who was upset about the way that their insurance had been handled. And so people are upset, but if you look at, like, United Healthcare made $23 billion last year in profits. That is not like, that is actual net profits. And so, you see that essentially these people are paying for healthcare. They're paying, but then the doctors aren't getting it, and the people aren't getting the health services that they're wanting, and that money is all going to the insurers, who are now for-profit companies who are just keeping that money. And their model is to essentially deny claims and just keep the money. So, I think that we have to do something about that. I don't know what it is. I don't know if it's just do direct to, patient to doctor payments for preventative medicine versus going through insurance, if there's some sort of like legislation that needs to happen. But the insurance companies are running away with the profits here in the US.
Yeah, no, it's something, that's for sure. On the lighter side, think you're excited about breakthroughs in the field of medicine, longevity, that you're looking forward to?
I'm excited about so many things. I mean, a lot of things are not, we can't do them yet, like some of the gene therapies or the cellular reprogram, where you turn cells back, you essentially turn their age back in time. And they're doing this in animals currently. They're not doing it in humans yet. It'll probably be at least 10 years before they're even considering that in humans. I'm also excited about some of the drugs that are available, already on the market, already available, that are being used off-label for possible improvement in longevity. So, and some of these drugs you've probably even heard of, like for instance, Ozempic, which you've heard of probably for weight loss. I mean, everyone has, right? Ozempic and the GLP-1s, they have multiple benefits across the entire body. And so some doctors, including myself, have used these medications in low doses. Instead of the doses that cause weight loss, we use them in low doses to try to improve inflammation or improve, joint pain or neurologic health or things like that. So the GLP-1s are one group of medications. Another group are called the SGLT2 inhibitors, which are diabetes medications, but also have these full body benefits. Rapamycin, of course. So there are these drugs that are already approved for use for other causes that seem to have benefits, that potential longevity benefits as well, that I think are really exciting to think about.
Fun, cool. Vision for your companies, like long term, where do you want to take all this?
Oh my goodness, yeah, that's a great question. I mean, with Humanot, our goal is to open 100 locations across the U.S. by within 5 years, and the first probably 7 or 8 even within the next year. So we're going to move fast and hopefully really be the first people to scale this type of preventative, proactive optimization medicine. And then with HOP, I really want to be able to get out to more women, really provide a lot of education, yes, products, but mostly education about what's available, what's not happening for women that's happening for men, how can we change it. I can just be like a positive force and of fun in that industry.